Cancer is a continuously growing global health problem that poses major challenges, most especially in developing countries. Find out how this international distributor of innovative health products came up with a series of solutions to help increase a patient's chance to survive the odds. In 2020, the Philippines hit a record of 354,398 prevalent cancer cases within a 5-year period. But because of poor access to health care, especially for people living below the poverty line, the advances and breakthroughs in cancer remain unattainable to many.
Cancer refers to a group of diseases that's characterized actually by cell growth, abnormal cell growth and proliferation, inflammation, as well as angiogenesis or formation of new blood vessels. It always starts with mutation in the genome or the genetic makeup of a person inside the cell. Before PPARs, most of my patients, they were unable to finish the chemotherapy regimens because of the side effects and because of discomfort during the process of chemotherapy.
Maria's son Dominic was diagnosed with stage 4 rhabdomyosarcoma when he was only 4 years old. While coping with the recovery of her other sick child, Maria found it hard to accept Dominic's condition.
It was actually very devastating kasi with Dominic, it was manifested mga 4 years old na siya. Unlike dun sa daughter ko na congenital talaga, baby pa lang. Yung mga bandang September, meron ng umbok-umbok dito sa leeg niya. Hindi ko talagang iniisip na cancer kaagad siya until nag-nosebleed siya.
Dominic was prescribed chemotherapy, but his family insisted to rush to an integrative doctor to seek for alternative cure.
Medyo hesitant ako kasi as a mother, I know the side effects ng chemotherapy kasi. So what I did is that I rushed towards the integrative doctor of my daughter, who happened to be PPAR partner doctor of Simply Nature.
One of the hardest decisions to make for people living with cancer is choosing the kind of treatment that would work best. To help patients and their families deal with this growing health problem, one company commits to producing safe, credible, and natural health solutions by drawing on the latest bioscience technology to deliver a series of safe, efficient, and natural products. What is Simply Nature and what does it do?
Simply Nature is a company we created and founded about 10 years ago. Our mission is to find effective health solutions for people. So we provide natural products that work in combination with conventional therapy and medicine.
As an international company that provides natural solutions for cancer, metabolic syndrome, and degenerative diseases, the management upholds a health philosophy that centers on whole food nutrition as the frontier in health management.
When we talk about choosing treatment, especially in the area of cancer, patients are really afraid of chemotherapy because of its side effects, and they tend to then look towards natural products. But this is not either conventional or natural choice. At Simply Nature, patients can have the best of both worlds. Our protocols work with conventional chemotherapy to minimize its side effects so that they can get the best treatment using both conventional and natural together.
Cancer is like a virus. It continuously evolves, it mutates. So it can develop defenses against our usual treatment modalities like chemotherapy.
Like I said, chemotherapy and radiation therapy have a lot of side effects. So more often than not, patients stop their treatment because of these side effects. It's very important to have the support.
With the supplements that we give the patients, there will be lesser side effects, so they will be able to finish their chemotherapy protocols more comfortably.
This company introduced PPARs, which is touted as one of the best natural ways of solving serious health problems.
PPARs stands for peroxisome proliferator activating receptors. It's basically a nuclear receptor found inside the cells. Now, when these receptors are activated, the benefit that you can get from that is, number one, cellular differentiation. Number two, it's to promote fatty acid metabolism. If you have better insulin function, your blood sugar will naturally go down. And another one is to induce cancer cell death by modulating the immune system.
As a sole distributor of PPARs, the company promotes its use to many reputable health institutions worldwide and actively organizes corporate health conferences and public health talks in Asia.
Simply Nature PPARs is made out of a special strain of these types of microalgae. It is very effective by protecting the bone marrow. We maintain the integrity of the immune system of the patient, which is very important to prevent infections and to fight off the cancer itself. And also, Simply Nature PPARs is also very dense in nutrients so that the patient can recover faster because of better cellular healing.
Sabi ko parang na-lead kami to an extraordinary and I must say amazing journey. I'm very proud of him. At a young age, na 8 years old, he believed that it's his purpose to siguro encourage other people then. We would like to really pay it forward with the knowledge that there's really like Simply Nature that can help people with cancer very much.
When fighting cancer, living healthy is very important because it allows us to pursue what is important to us in life, and that's what it's all about. When we can help a patient move from being bedridden to getting up, to be lucid in thought so that they can have conversations with their loved ones, it gives the whole process of fighting cancer a whole new meaning. And that is what drives us at Simply Nature.
I came to know PPARs when Pascual knew about PPAR.
Yeah.
I started taking PPAR a month after that because I was able to buy one. I only have stage 4 cancer of the prostate, and that's nothing. I went to him 2 weeks ago, as I used to go to him every quarter. His record showed that last March of last year, my PSA went down to normal level. And he told me, "You haven't come to me since March, and your PSA is still normal." Until I presented to him a result taken last December, which is normal. And he has not been giving me chemotherapy. So since then, my PSA has been normal.
Okay.
And he asked me, "Are you taking anything else?"
Uh-huh.
And I told him, "Yeah, I'm taking PPARs."
Wow.
"What's that?" I said, "It's chlorella." The next question was, "Is it available in the Philippines?" And I said, "Yes." Then he asked me, "Can you ask the representative to come and see me? And probably it can help other patients."
I have a patient, 73 years old. His case is high in PSA. They are afraid that this is a cancerous based on his medical doctor. But I give him PPARs a month ago. The result is very wonderful because the PSA is going down. So now, based the laboratory result, his case is not cancerous already. That's all.
Yeah, actually I bought PPAR for my family. I have brother who has diabetes, with heart problem, with prostate problem. He's taking a lot of medicine. So at first I tried the PPAR tablet. The following time I bought the gel. And I'm so happy that he's taking the medicine routinely. And what happened, his blood sugar went down. And then instead of taking 2 medication of anti-diabetic medication, he only take it 1 medication, and then it's every other day. No more arrhythmias, and then the prostate is okay. And then out of curiosity, I tried to take PPAR on myself, and it's very good, no? Actually, I'm a cancer survivor since 1998, and I'm so happy. I am cancer-free, and I'm energetic, and I look young. Do I look 64? Thanks to PIPAR for making me young, making me strong, making me as energetic, and I know health is choice, and the choice is taking PIPAR.
I am Romeo V. Gavin. To listen to Dr. Tanya Tue when Pascual invited the group of INAM to a roundtable discussion about your office. It was very timely because after that was the time when I was just released from the hospital. My illness is JEP, POS, renal failure, 3rd stage, and I have cancer of the prostate, 4th stage. So I was before I was being treated with injections of estrogen. Sabi ng doktor, lalaki raw dudo ko, kaya naghahanap na ako ng brown honey. My PSA level then was 145. After the first injection of the estrogen, it went down to 49. The doctor did not know that I started taking PAR. That was when a PSA determination was done, my level went down to normal. Akala nung doctor, dahil doon sa injection niya, hindi ko sinasabing I'm taking PAR. Now I'm taking PAR for the past, I think 3 or 4 months. And I'm due for another PSA determination, and I hope it stays normal. I haven't received injection for the past 6 months. If the PSA remains normal, I can I conclude? Siguro I can suspect that it's due to PAR. But I have other experiences with PAR. I have a friend who has a brother who is diabetic. He is taking 3,000 milligrams of metformin and having insulin injection morning and evening. I convinced her to give PAR to the brother. After a week, the brother is no longer taking insulin because the metformin apparently was able to control the blood sugar with the help of the PAR. And now the brother is in the right stage. The sister is continuously sending him PAR. I was asking a friend to get the results of the blood sugar because that will be our evidence base. Wala pa hanggang ngayon. Another incident. Yung father niya has Alzheimer's. The father do not recognize them for the past 3 years. Lagi sabi niya, sino po ako? Kapatid kita. Yan ang sinasabi lagi. 3 years yun. When he started taking PAR, I think after 1 or 2 weeks, he showed sign of cognition. And ngayon, kilala na sila, alam pangalan nila, pati mga kaibigan na takanda na ang pangalan. At nakakasulat na. Dati hindi.
After 2 months, ng aking therapy and taking PPARs, sabi ni doktora, magpa-laboratory ka na. So, nung nagpa-laboratory na ako, praise God, 2 weeks ago or 3 weeks ago, lahat normal. To God be the glory, salamat sa Diyos, sa 2 months ko po ng aking pag-take ng PPARs, ako po ay cancer-free.
Good day mga ka-Simple Nature! My name is Jenny Lay and you are watching another episode of Simply Nature webinar. You are in for a treat because tonight's topic is entitled Prostate Cancer Treatment Options, Weighing the Pros and Cons. You know, prostate cancer remains to be one of the top most common form of cancer in males worldwide. So citing the 2020 data, the DOH said that the prostate cancer is the fifth leading cancer site and third leading cause of cancer deaths among Filipino males. You know, joining us is the PPARS expert from Singapore, who is also the CEO and founding director of Simply Nature International. Let's all welcome no other than Mr. Shyan Liu.
Hi, everybody. Welcome to the program tonight. It's so good to see everybody. Good evening, Aline from Aline Bakatan and our other viewers as well. A lot of first-time viewers tonight. We are in for a treat. We're going to have a short testimony after this, right? A case study of a prostate cancer patient. Yes. And Dr. Johnson will grace us with another wonderful, insightful lecture about prostate cancer. So get ready tonight. You're going to take a look at a case study of a person undergoing prostate cancer treatment. Yes. And you're going to learn a bit more about the technicals about prostate cancer.
We know you all missed him, our lifestyle medicine specialist. Let's all welcome back Dr. Johnson Kalala.
Yay! And that answers Bain Reyes. He asked, is there free consultation tonight? Yes, there is, because after this segment, there is a Ask Me Anything segment.
Okay, so let's start with a triple treat of success stories. We'll be watching the 73-year-old patient with Dr. Josephine Belmonte, then the brother of Dr. Elizabeth So with diabetes and prostate problem, followed by Dr. Gavino. Let's all watch this.
I came to know PPARS when Pascual knew about PPAR. Yeah. I started taking PPAR a month after that because I was able to buy one. I only have stage 4 cancer of the prostate, and that's nothing. I went to him 2 weeks ago, as I used to go to him every quarter. His record showed that last March of last year, my PSA went down to normal level. And he told me, you haven't come to me since March, and your PSA is still normal. Until I presented to him a result taken last December, which is normal. And he has not been giving me chemotherapy. So since then, my PSA has been normal.
Okay.
And he asked me, are you taking anything else? And I told him, yeah, I'm taking PPARS. Wow. What's that? I said, it's chlorella. The next question was, is it available in the Philippines? And I said, yes. Then he asked me, can you ask the representative to come and see me? And probably, it can help other patients.
I have a patient, 73 years old. His case is high in PSA. They afraid that this is a cancerous based on his medical doctor. But I give him PPARS a month ago. The result is very wonderful because the PSA is going down. So now, based the laboratory result, his case is not a cancerous already. That's all.
Yeah, actually I bought PPAR for my family. I have brother who has diabetes with heart problem, with prostate problem. He's taking a lot of medicine. So at first I tried the PPAR tablet. The following time I bought the gel. And I'm so happy that he's taking the medicine routinely. And what happened, his blood sugar went down, and then instead of taking 2 medication of anti-diabetic medication, he only take it 1 medication, and then it's every other day. No more arrhythmias, and then the prostate is okay. And then out of curiosity, I tried to take PPAR on myself, and it's very good, no? Actually, I'm a cancer survivor since 1998, and I'm so happy. I am cancer-free, and I'm energetic, and I look young. Do I look 64? Thanks to PIPAR for making me young, making me strong, making me as energetic, and I know health is choice, and the choice is taking PIPAR.
I am Romeo V. Gavino. To listen to Dr. Tanya Tue when Pascual invited the group of INAM to a roundtable discussion about your office. It was very timely because after that was the time when I was just released from the hospital. My illness is JEP, cause renal failure, 3rd stage, and I have cancer of the prostate, 4th stage. So I was before I was being treated with injections of estrogen. Sabi ng doktor, lalaki raw dudo ko, kaya naghahanap na ako ng brown honey. My PSA level then was 145. After the first injection of the estrogen, it went down to 49. The doctor did not know that I started taking PAR. That was when a PSA determination was done, my level went down to normal. Akala nung doctor, dahil doon sa injection niya, hindi ko sinasabing I'm taking PAR. Now I'm taking PAR for the past, I think 3 or 4 months. And I'm due for another PSA determination, and I hope it stays normal. I haven't received injection for the past 6 months. If the PSA remains normal, I can I conclude? Siguro I can suspect that it's due to PAR. But I have other experiences with PAR. I have a friend who has a brother who is diabetic. He is taking 3,000 milligrams of metformin and having insulin injection morning and evening. I convinced her to give PIPAR to the brother. After a week, the brother is no longer taking insulin because the metformin apparently was able to control the blood sugar with the help of the PIPAR. And now the brother is in the right stage. The sister is continuously sending him PIPAR. I was asking a friend to get the results of the blood sugar because that would be our evidence base. Wala pa hanggang ngayon. Another incident. Yung father niya has Alzheimer's. The father do not recognize them for the past 3 years. Lagi sabihin niya, sino po ako? Kapatid kita. Yan ang sinasabi lagi. 3 years yun. When he started taking PIPAR, I think after 1 or 2 weeks, he showed sign of cognition. And ngayon, kilala na sila, alam pangalan nila, pati mga kaibigan na takandaan na ang pangalan. At nakakasulat na. Dati hindi.
Hello, Shyan. Hello, Jen. Hello, everybody. Happy to be here again. So tonight, I'm gonna show you 2 articles that studied early stage prostate cancer and prostate cancer recurrence and how the researchers treated these patients. So first one is a study by Dr. Dean Ornish. So this is actually a proof that early stage prostate cancer can be treated all naturally. So what he did was to use a whole food plant-based diet, regular moderate physical activity, and stress management on prostate cancer patients, and he monitored its progression, or its worsening or improvement over time. So what he did was he divided the participants into 2 groups. Okay, so take a look at this graph. So Dr. Dean Ornish divided the participants into 2 groups. one for the control and one for the experimental. So the control group is those who ate the standard American diet. So all of you know what the standard American diet is. It mainly consists of a lot of processed foods, no? So sausages, burgers, a lot of fried foods. Okay, and very minimal fruits and vegetables actually. So the other group, the experimental group, followed a whole food plant-based diet. This is the group who did the plant-based diet, the stress reduction techniques, the stress reduction exercises, and the moderate intensity physical activity. So what he did was to collect blood samples after 1 year, no, putting these participants on these two diets. So after a year, he collected the blood samples, and the blood samples were dropped on a petri dish, okay, full of prostate cancer cells. And this is the effect, no? This graph is the effect. So on those who were following the standard American diet, these participants were able to stop the growth of prostate cancer cells by 9%. On the other hand, the participants who were following a plant-based diet or who were eating a plant-based diet were able to stop the growth of prostate cancer cells by 70%. So if you just compare 9% versus 70%, which blood do you want to have circulating in your body? Okay? Of course, it is the blood of a person who is eating a plant-based diet. So your blood will be very much hostile to cancer cells, especially for prostate cancer. Now, let's take a look at the response of the PSA. Now, for everybody's information, how do we screen for prostate cancer? It's mainly with the use of PSA or the prostate-specific antigen. Now, whenever this specific biomarker or blood marker increase, it is a telltale sign of prostate cancer. Although, other diseases can also manifest as elevated PSA, So, elevation of PSA just tells us that there's something wrong with the prostate. However, of course, these participants are all diagnosed case of prostate cancer. So, what Dr. Ornish did was to collect PSA at the baseline and then collect PSA again after a year, So again, those two groups, the groups following the standard American diet and the group following the plant-based diet. So those who were following the standard American diet, as shown in this slide, the PSA of those who were following the standard American diet actually increased their PSA from an average of 6.36 to an average of 6.74. Now, if your PSA increases, this is a sign that the disease is progressing, okay, or it is worsening. Now, on the other hand, those who were following a plant-based diet, from an average of 6.23, it decreased to an average of 5.98. Okay? Now, a decrease in PSA means that the disease is improving. So this is actually an evidence that early-stage prostate cancer can be reversed with just natural means. Now, what if you already have an advanced type of prostate cancer? Like in this case, this article actually talked about the influence of diet in conjunction with stress reduction and its effect on prostate cancer recurrence. So, this study actually studied 10 participants. However, although the sample size is quite small, however, once we study this further, you'll realize that this is actually a very important study. Okay? So, for this, they monitored fiber intake and the PSA. So, this table describes the fiber intake of the 10 patients. Now, how did this group do? Prior to the study, this group actually had very low fiber intake. After the program, only 4 individuals increased their fiber intake, highlighted in blue. Okay, so let's take a look at subject 2, who had the greatest increase in fiber intake, and subject 9, who had the greatest decrease in fiber intake. This is their PSA change, or the change in PSA. So subject 2, or patient number 2, had the greatest decrease in PSA levels, while subject 9 had the greatest increase in PSA level. So this is also a telltale sign that fiber intake has a big influence on the PSA levels. Okay? Now, please mind you, these participants are actually participants who have had prostatectomy already. their prostate was removed completely. So when the prostate is removed completely, what will happen to the PSA? The PSA will be 0 or near 0. Okay? It should be at that level. Now, if you already have your prostate removed and your PSA increased, then that is a sign that the prostate cancer recurred. All right? So as you can see here, no, this is the change in their PSA. All right? Now, if we put all of them together, no, so indeed, the greater the fiber intake, the greater the decrease in PSA levels. This is evidence that a plant-based diet can decrease the rate of PSA increase and may slow the rate of tumor progression in recurrent prostate cancer. Please take these information that you just learned with a grain of salt, okay? Because these participants were put in a very controlled environment, meaning they lived in a resort or in a very in a hotel, no, and they weren't let out. So every day the researchers were feeding them a standard diet, okay, a diet that is designed for the study. However, this cannot represent the real world scenario. However, it is enough for us to know that prostate cancer can be reversed with just natural means alone. Now, how is my approach in the real world scenario? I use natural means, so I use lifestyle change similar to what the researchers did, and also I still refer my patients to urologists and oncologists so you can receive the proper medications, get treated, so you can increase the rate of survivability.
Now you have heard it from not only one, not two, and not three, but four medical experts who personally experienced the Simply Nature PPARs for themselves in resolving not only prostate health concerns, but also other comorbidities. Before we start, I'd like to greet our avid viewers, Ms. Edna Aveo, Arlene Verago, Ms. Josie Sumila, and Ms. Alicia. Hello, good evening, and welcome to our program. So questions are very much welcome. Type them down in the comment section below. Now, what can you say about our very inspiring success stories, Sir Shyan and Doc Johnson?
So I guess we are in the NA already. First of all, I just want to say Doc Johnson is back. Hallelujah. So we are going from this Thursday onwards. Please tune in again. We are going back to our usual programming where we have lively discussions, all right? And you will learn a lot. I'm stealing Doc Johnson, your line. Thank you. I hope you have learned a lot tonight. So number one, Doc, for me, it was this sharing this evening was a bit different because it's not normal people. They were all doctors. And I think, Doc, I just want to ask you a question. Being a doctor doesn't mean you live a healthy lifestyle, huh?
No. I mean, all of us have seen our doctors one way or another. I'm sure with all our viewers, you've seen your doctors. I mean, if you look at them, you can gauge, right? Just by looking at them, you will know
they are not the healthiest people in the world.
Not the healthiest people in the world. You'll know just by looking at them. So not all doctors do, but it would be a very good example, no, if your doctor really walks the talk, right? So
there, the person on my left walks the talk, right? You can look at him. Bogi, that's the correct Filipino Tagalog word to use, right? No, what is important is that doctors choose the protocols and the recommendations that we're sharing tonight, right? It's very funny, Doc Johnson, I noticed this very funny thing. There are many eye surgeons who do the LASIK.
Yep.
But they wear glasses. Which is like, they tell you LASIK is good, but they wear eyeglasses. So I think what's always very telling and what's really important is what do doctors do when they get the illness instead of being on the other side. So it's very nice to see doctors sharing their stories with our protocols, with the knowledge that Dr. Johnson is sharing with you tonight. All right, so yeah.
Yeah, I can see questions coming up and thrown privately. So why don't we go now in the what we call AMA or Ask Me Anything version. Okay, first question coming up from Nathaniel. It's sent to us privately. What symptoms should I watch for?
Oh, Doc, when would you suspect that you have prostate cancer?
Yes, actually, it's very.
Oh, first question, Doc.
Yeah.
Can ladies have prostate cancer?
No, you don't. Ladies don't have prostate.
Just have to ask. I just have to ask.
Well, if you are a trans.
Okay, yeah. In today's world, that's another.
Not unless you've had certain procedures, certain surgeries done, no, that would remove the prostate, then that's the only time. But I'm not quite sure. I'm not a surgeon who does
The
surgeries, right? What do you call them? Trans or
sex change
sex change surgeries.
But prostate cancer is only guys.
Guys, because the prostate is unique to men. Okay.
So all the ladies, I know you're listening for your husband and your sons and your loved ones, and you can later inform them.
Yeah. Okay, so to answer Nathaniel's question, what signs and symptoms do you see, no, or do you feel when you have prostate cancer? Actually, majority of prostate cancer patients don't have any symptoms at all. Okay.
No symptoms.
Yeah, most of them don't.
So how would we know?
Yeah, how would we know? So to understand the symptoms, no, first we have to understand the anatomy. Where is the prostate located? So if you are on your computer, in front of your computer, just Google around, type where is the prostate located, then go to
images.
So you'll see there. So the prostate is actually like bulb shape, much similar to garlic. Okay, it's shape similar to garlic, a shape similar, close to kisses chocolate. Okay, inverted down. Okay, so that's how the prostate looks like. So the prostate is mainly located just below the urinary bladder. Okay, it's at the neck of the urinary bladder. So the urethra, okay, the tube coming out, no, from the coming out of the urinary bladder passes at the center of the prostate gland. Okay, now the prostate is also located in front of the rectum. Okay, and just at the base of the penile shaft. Okay, so that's where the prostate is located. Now, when you have prostate cancer, so we understand that cancer is a tumor, no? Tumor that is growing in size. Okay, so if it's growing in size, so you have a mass there, then that mass, okay, or just the prostate enlarging, can constrict the urethra or the tube coming out of the urine, right? Okay, so you'll have what? Difficulty urination. Now that is a very vague description, but difficulty urinating can sometimes mean, you know, the
other medical issues.
Yeah, other medical issues. So, well, some of them, no. The arc is how do I say it? The arc is weaker. You know, when men urinate on there's an arc. Okay.
Oh, okay, yeah. Women, you don't know what that is because you guys
it is
different.
Lower. Okay. So another one is sometimes you have to strain. You have to strain to urinate. So much like defecating. When you defecate, you squeeze the stool out, right? You strain. It's very similar. You have to strain so that to let out the urine. Okay. Another one is it's very easy for you to feel about to urinate already. Yeah, so this means that the urinary bladder is very full.
Because it's not coming out.
Yes, it's not coming out, so it's like around, sometimes it's right, like for example, it's like 70% full always. So with just a little bit of drinking water, you urinate immediately. Okay, so this kind of symptom is what we call as urinary frequency. So the urinary frequency is that you urinate so frequently, much more frequent than the regular person. Okay, so of course, if you drink a lot of water, you're gonna urinate a lot, right? But one telltale sign is when you urinate a lot at night and it interrupts your sleep. So that is what we call as nocturia in medical terms. Okay. Now, when a person experiences nocturia, of course, one time you wake up one time at night to urinate, that's normal. But 3 times, you wake up 3 times at night, that is a warning sign that something is wrong. Okay? So when these things happen, though, you have to go to your doctor and have a consult. Yeah, these are the most common symptoms. Now, these symptoms that I have mentioned can also manifest in prostate conditions that is not cancer. So a simple prostate enlargement or benign prostatic hyperplasia in medical terms, no, which almost all men go through when we grow old. Okay, the prostate just enlarges, but it's not cancer. Okay, so these symptoms can happen as well. Also, diabetes can manifest as urinary frequency too. So this just tells us, no, when you feel these signs and symptoms, you have to go to your doctor to seek medical help because something is wrong. Something is definitely wrong. Okay, more studies have to be done. Workup has to be done for you to get diagnosed. So to find out what is really wrong. So on the get-go, when you feel this, don't panic, don't be scared. This just tells you that okay, you have to get medical attention already. Okay?
Doc, and when we do go to a doctor, one sure way to not be afraid to rule out cancer is actually just to do a prostate exam, right?
Yes, very simple. Get a blood test, which is the PSA test. It's taken from the blood. Urologists or your doctors would also, depending on your symptoms, no, your doctors would also do a digital rectal exam. So that is a nightmare.
Test it, all right?
Yeah, but the doctors have to do this to know, no, if your prostate is enlarged, because just by feeling the prostate, a doctor can know if this prostate is it leans more towards malignant or leans towards a benign category.
So there you go, and that's why next year I have to go for the first prostate exam in my life, because next year I hit the golden age of 50. So 50 years old is when every male should go for their very first prostate exam. But Doc, there is a rule, right? If someone in your family has cancer, you go for the test earlier.
Yes.
What is that rule, though?
It depends really, on the doctor's assessment. But general rule of thumb, if there is someone in your family who has cancer, I would generally advise you to get screened 10 years earlier.
So that means if they got cancer at age 30, you should do screening at age 20, all right, and not wait until 50. So whatever the age of your family member who got cancer, you just minus 10. That's the minimum age that you should go for the same test for the same type of cancer as your family member. But of course, if your family member is 70 before he got prostate cancer, you minus 10, that's 60. So it means you should do your first one, not at 60, but at 50, all right? Yes. Either 50 or lower, okay? Not later than that.
Thank you, Doc. I guess that answers the question of James, which is, can you detect prostate cancer by just looking at the urine? So, good.
Yeah, in a way, if your urine, I think he's asking, what if it's maybe when there's blood in there, or
this is a little bit tricky, okay?
Wow, I'm learning something. When Doc says that, he's going to share something.
Okay, so when we're looking at the urine, so what I'm saying here is urinalysis. Okay, so this is a medical test that we usually request for. So in the urinalysis, what are the signs that a person can have cancer, for example? No, so one is hematuria or blood in the urine. Okay, so why is there blood in the urine?
Yeah, that's scary.
It's because tumors tend to develop blood, or they tend to develop their own blood supply. And since these tumors are abnormal cells, so they don't have the normal architecture of normal tissue, right? So the blood vessels are a little bit more friable. They're easy to they are easy to, how should I say this?
Burst?
They're easy to burst. It's very, the term is friable. Okay? Just Google what friable means.
Yeah, easy to split.
To destroy. Okay, so if the blood vessel is so fragile, then blood can ooze out. So the blood will go where? It will go to the
urine. So if you have blood in your urine.
Now, when you have blood in the urine, of course, that is not normal. Okay?
And that should be very scary to every guy, right?
Yes.
It's not normal. We are afraid if we see that.
Okay, that is a sign of prostate cancer, but that is not the test to diagnose prostate cancer. Okay, when you have blood in the urine, it's not 100% you have cancer, okay? No, because there are more common conditions that can have blood in the urine.
Yes,
Example is kidney stones.
Yeah.
Okay, that's one.
Doc, I once was frightened out of my wits because I had blood in my urine. I realized it's because I drank not very little water and I exercised to an extreme level. Yeah, I googled that. I was so scared because like, why is my urine pink in color? So there are many conditions, but at the end of the day, go and see a doctor. All right, go and see a doctor.
Yes, so for those of you who wish to have a consult with Dr. Jansen Kalalan, the link to schedule an appointment is in the description box and comment section below. Our pretty healthcare specialist Beth will reach out to you shortly.
You know, I just want to take an opportunity to interject at this point. I think the traffic is back here in Manila. It's terrible, and I think recently I had to go to the hospital to visit someone or for something. I can't remember. But all I remember, I don't remember why I was in the hospital, but I remember the long queues. Okay. So one of the things I just wanted to encourage everybody, you know, when you listen to a program like ours, one simple thing that can happen is you might start to have a lot of questions. So don't scare yourself and don't worry, you don't have to go for any terrible traffic or anything. It's not a hassle. Just type a message in the messenger and arrange for a short consult with Dr. Jansen. All right. So he will be able to quickly diagnose, talk to you, and get to the root of your problem. And either that will give you the peace of mind to sleep, all right, to know that nothing's wrong. Or if there's really something wrong, then you can catch it early and start to take the right actions.
Yes, that's correct. So our next question, I think this one is a weightlifter because his question is, can you still exercise with prostate cancer?
Oh, you should.
You should. The answer is not can, but you should.
You should.
All right.
This is not just for prostate cancer, okay? For all cancer patients across the board, okay? Studies have shown, no, physical activity. If you're physically active, you reduce the chance of the cancer returning when you are already on remission. That's one benefit. Another benefit is when you undergo treatment, side effects are less. Way less.
Wow.
For patients who are undergoing chemotherapy, radiation therapy, one of the common side effects of this is fatigue. Now, fatigue is the more, it is the most debilitating side effect of these treatments. No? Because if you experience fatigue, you can't really do anything. And when you really can't do anything, everything is so gloomy. Your mood.
Yes.
You don't want to do anything.
You feel worse than you actually are.
Yeah, quality of life is not good. So for me, it's the most debilitating sign. More debilitating than your numbness, these immune system going down. Because we always have answer to this side effects. Okay, medication, supplements, whatever. But when you experience fatigue, oh my gosh! Even if you sleep, when you wake up, you feel fatigue again. Okay, so exercise. You have to exercise, as much as you can.
Doc, is that so exercise is really good for cancer patients. I just want to say hello to Raymond and to Ms. Valdez all the way from Sydney, Australia. So truly, our audience is from all over this side of the world. We just need someone from Europe and the US, then we'll cover the whole globe. But Doc, a question here. Can a cancer patient do more than the gentle exercises like brisk walking? Can they do something more vigorous, like weightlifting? Yes, they can.
Yes.
Is it good for them?
It's good for you. Number one, for cancer, having a cancer diagnosis is not one of the contraindications to prevent you from or advising against exercise. Okay. If you're a cancer patient, you're strong enough. Go. If you really want to do, if you love doing vigorous intensity physical activity, go. Okay, because that would not only help with your cancer itself, not the treatments that you're gonna undergo in the future, but also your overall health, cardiovascular disease. Cardiovascular disease is still the #1 killer. Another, if you don't die from your cancer, you're gonna die of heart disease.
Yeah.
Okay.
So that's really very true, Doc, that many cancer patients don't actually die from cancer. There was a particular cancer patient, breast cancer patient, she was doing so well with the treatments But then she caught a flu and she developed pneumonia. She died from the pneumonia, doc.
Yeah.
She died from the pneumonia, not from cancer, not from chemotherapy. She died from the pneumonia. Obviously, she was weak. So exercising, keeping your body strong, your heart strong, that just means one less thing to worry about. So that's really wonderful. Thank you, doc.
Coming up, our next question from Mr. Gabriel. Is prostate cancer prone to recurrence?
Oh, that's a good question.
Yes, it's a good question. Answer is not so much. That's the good news.
Wow. And is prostate cancer one of the slower growing cancers?
Yes, it's true. It's also true. It's slow growing. Also, if prostate cancer is also one of the few cancers that can be reversed naturally, all naturally. You know, actually, in the guidelines, for early stage prostate cancer, there is something that we call a watchful waiting.
Yes, I was very surprised. You know, when I first met an oncologist who told me about this, that when you're actually diagnosed with early stage prostate cancer, the right thing to do is to do nothing. Which is
it's in the guidelines.
Yeah, they just watch. But okay, that's not true, right, doc?
No, that's not true.
That's not true. Okay, the onco will do nothing. He'll watch because the tools of an onco is radiation therapy, chemotherapy,
surgery,
right? So he's the soldier in the whole cancer journey. He's like the one that will bring the M16 and the missiles, right? So he's not ready. You're not ready to blow things up yet. Okay, but that doesn't mean you do nothing. So Dr. Johnson is the one that you want to go to oversee your whole entire cancer journey. Because even while your oncologist is waiting for your prostate cancer to develop, Dr. Johnson, you will already have protocols for the patient.
Yes. Now, let me explain why why the medical societies, the medical authority globally had this recommendation. Okay, let me explain.
The recommendation of
watchful waiting.
Just watch.
We don't do anything. Okay, it's because prostate cancer is so slow growing that when you get detected, when they screen you and you have prostate cancer, sometimes the cancer doesn't really grow. Sometimes the cancer outlives you. Meaning
your natural life is shorter.
Yeah, your natural life is shorter than when the
cancer
causes significant debilitating effects on your body. Okay, so that is how slow growing prostate cancer is. But of course, this does not happen to everybody. Okay. Another one is sometimes prostate cancer can also heal itself. Okay?
Wow.
There's something that we call a spontaneous regression in medical terms,
that's a good news.
Yeah, so this one is literally a miracle because it's an occurrence that is very, very rare. Okay?
But it could happen.
Yeah, it can happen. Okay, so at this stage, the tools that we use to fight cancer have their risks, of course. Now, when you weigh the benefit and the risk of having these treatments, the risks outweigh the benefit. Okay, so that's why they had this watchful waiting recommendation. So since you have this, let's see. If the tumor grows, then let's do something about it. But if the tumor doesn't really grow, it's like there, and your PSA is high. I mean, it's cancer, but it's just there. Then do nothing. I mean, let's just wait for it to let's see what happens. However, of course, you on the other side, I mean, you're the patient, you get diagnosed with cancer. That is a very stressful thing to
do nothing about.
Do nothing. What I want to be proactive about it. So what are you gonna do?
So what would you tell your patients, the patients that come to you?
Yes, so lifestyle change is the most important thing that you have to do because the risk factors for prostate cancer is also lifestyle related. Okay. One of them is obesity and then the standard American diet, actually. Okay, so what do I usually prescribe to my patients? It's go on whole food plant-based diet, exercise, don't stress out, be positive in life, stop the vices. And that's it. It's as simple as that. Okay, then supplements, I usually prescribe supplements even just to make sure that you are healthy. Okay, so yeah.
And even in your lecture just now, you mentioned that PSA levels can go down significantly with the increase of dietary fiber, right? So there are many tools that you have. Doc, just now when you said whole food plant-based diet, there's a dirty word in there. The dirty word is diet. Every time someone hears the word diet, it means unpleasantness, right? You have this feeling like I cannot eat what I really want to eat, right? So, so that again, just go and have a consult with Dr. Johnson. You'll be surprised. Okay, what is going to happen is that you will make different choices instead. You will still choose to eat what you would like to eat. Okay, but the choices are healthier. Okay, and there are a lot of tools that you can use so that you can achieve this healthier choice without suffering. Okay, so that one example is if you are a person who really doesn't like to eat a lot of fibrous vegetables, you can always take a product like Simply Nature Cleanse, which is rich in dietary fiber. And as you feel better, you will find that naturally you will start to choose to eat more vegetables and foods that are rich in fiber. But it's a good way to kickstart. Doc, I've spoken to specialists who do weight loss. So if you go to those famous, I'm not going to name any one of them because they might get angry with me by sharing the secret. All right. So the secret to when you pay like 100,000 pesos or 50,000 pesos to lose weight, and then you'll be very excited because once you start on their program, after 4 days, they're going to ask you to weigh yourself and you'll be like, oh, this is worth the 50,000 pesos because you have already lost 2 pounds. Yeah. But you know what? The first 2 pounds they help you lose is water. All right. It's not really the fats, but it's just water. So what am I just saying is that it's a very important process. You got to see yourself getting thinner. You got to see yourself succeeding, right? Succeeding in this process. That is why even as you go about doing lifestyle change, as you talk to Dr. Johnson, you're going to find that there are ways to allow you to know that you are making positive steps. And something as simple as like, taking a sachet of dietary fiber, I have taken what I need to eat today. So I've already succeeded. I've already eaten more fiber than I've ever had in my life. So it's not so difficult, everybody, that we can make these lifestyle changes because in the initial period, there are many tools that Dr. Johnson will share with you when you go for his consult that will help you achieve all the things that you need to achieve, right? So you need to have enough dietary fiber. There'll be something to help you achieve that. And then and that gives you more time and momentum to make more long-term and deep, meaningful lifestyle changes.
Yeah, actually, there's a question from Shopee by Miss Mergy. She said, I'm allergic to raspberries. Can I still take the Cleansing Plus?
Oh, yes. We have no raspberries in Cleansing Plus. All right. So that's good.
Another question from Shopee from Mr. Alfred. Why do you need to take PPAR's tablet when you are already taking higher form of PPAR's extract like powder?
Okay, Doc, don't mind I take this question? Yeah, sure. All right, because that's my area of expertise. Okay, the reason is because I'm trying to think of a complete answer that won't take half an hour. Okay. Okay, the reason is because extracts are powerful, right? You are taking the higher form. But you will notice that when we take natural approaches or anything natural to have an effect, it's never just the star. Okay, I'll give you an example. We eat oranges to get vitamin C, right? That's what our mama always told us. Oh, you're coming down with a flu. You need vitamin C. Drink orange juice. Okay. Now we drink orange juice because there's vitamin C, but that's the star. That's the star of the orange. However, the white, the white part of a natural orange, when you eat an orange, that the white part, that actually has the the co-star. It's called bioflavonoids. Without that, when you take vitamin C into your body, I think less than 2 hours, it's gone. It's in your urine. You actually need the bioflavonoids in order for your body to hold the vitamin C, for it to stay in your system longer so that you can benefit from it. So when we take an extract, right, we are taking the star, the most powerful part of that plant. However, the co-stars are also necessary to support whatever the star does. right? So that's my simple analogy. So the extracts are taken from the tablet. So many nutrients are left behind, right? So your extracts are higher concentration in the PPAR agonist, the things that switch on your car. If your body is a car, the extract is like the key, you know? And when you switch on the engine, the car starts to work. Your immune system starts to get to work. Your body organs start to function properly. However, when you switch on a car engine, you still need your petrol. You still need your motor oil. So all these are actually found in the tablet, right? So when you switch on your car engine with the PPAR, higher forms of PPAR extracts, we always ask you to pair it with the tablets because that's your motor oil, that's your petrol, that's your lubricant to allow your car, your body to head towards the healing and the full recovery. All right, so that's why we always pair the two up together. Now, is it possible for you to just take the extract and not the tablets? Yes, it is, if you are eating very, very healthy, right? Because your car engine started, you need all these right nutrition in your body to fight the cancer, to get well. Now, knowing, Doc, you've had many patients for lifestyle change. I mean, what's your comment about the average Filipino diet?
Well, rice is a staple. I mean, the Filipino diet is actually very similar to the American diet or the Western diet.
Which is a sad diet.
Yes. Give you an example. The standard American diet, they have a very high. No, their foods are processed, so the sugar content is high, fiber content is low. We also have such foods or such delicacies here in the Philippines.
Yeah, just like my
biko,
Rice cake.
your rice cakes.
Oh yeah,
Very
my favorite is pico,
Okay.
but it's nutritionally empty,
Yeah,
but very tasty.
yeah, correct.
Ah.
So that's one. Okay, another one is the most famous one, which is lechon. Roast
Ooh,
pig.
lechon.
Yeah, American counterpart, bacon, ham.
Bacon, yes.
I mean, similar. Here, similar. Okay, chicken. Those who in the Western world and Filipinos all love chicken. Okay?
Yes.
So
I think Jollibee sells more chicken than burgers.
I mean, yeah, I've seen Jollibee's videos in the
It's all
US.
chicken joy.
The Americans love Jollibee. And you know, it's only here in the Philippines that a local brand beat
McDonald's.
Ah.
Yeah, that's
Yeah,
something to be
delicious
proud
the
for.
chicken of Jollibee is. Okay, so just looking at these similarities with the diet, we don't need to mention physical activity because technology is there. Okay, yeah, with these similarities, we can see when you take a look at the top 10 causes of death in the US, in the Philippines,
It's the
there
same.
are similar ones.
It's all the same.
Okay, heart disease, cancer, diabetes, these would be in the top 5, top 10, but if not the top 5. Okay, so yeah, there you go.
So there it is, the PPAR extracts, the higher forms of the PPAR protocol, they switch on your engine. However, once your engine is switched on, your immune system needs all the vitamins and minerals for all the different body processes so that you can fight cancer effectively. Now, that is not found in our diet. And I think everybody knows that are listening to that tonight knows that our diet is not complete. So this is why supplementation is actually not really an option if you are living in the city. If you live in the province and on a farm and eating farm vegetables, maybe you don't have to take the tablets. But if you're living in the city, it's a real challenge to find a balanced, nutritious meal. Even finding one a day, right?
Yeah.
It's very difficult. So, and if you find one a day, you probably can't eat that same thing every day for 6 months. So supplements is really one of the tools that you need to embrace while you're fighting cancer, especially if you're going to live a normal life, if you're still going to work. If you're going to work, you can't stay at home to cook that healthy meal, right? If you're still taking care of your kids, if you still have a busy life because you're doing well in your cancer treatment, it makes it even more difficult to live a very healthy food choices. So supplements is one of the ways you can achieve what you need for your body to perform, to fight against cancer. So be open to it and understand why you need it. We can try to go natural, but that would mean you have to give up your job. That would mean that you have to cook every meal yourself. That would mean you have to buy vegetables because you need to go to the real palenque and not just go to the supermarket where everything is full of pesticides and not organic, right? So with all those things, supplements is really something that is very necessary for those who live in the city. And I think that's most of us.
Thank you, Sir Shyan. Thank you, Doc. I'd like to greet our avid viewers, Miss Felicissima Siman and Miss Rowena Sikat. Thank you.
Yeah, we are back. Rowena, Doc Johnson's back. Okay, we're gonna go back to our Thursdays. We had quite a few super engaging sessions where everybody asked fantastic questions. There were quite a few episodes. So we look forward to having more of those as the dynamic duo come back together. All right. Yeah.
Okay. Actually, Mr. Alfred has a follow-up question.
Yes.
He
Yes.
said, is there any difference in effect for PPAR's tablet when you chew it or you just swallow it?
Oh, okay. Yes, when you chew it, it's actually better. But I will tell you the truth, I don't chew it because I don't like the taste. Okay, so I'm just being honest, right? I can't lie. I can't lie, you know.
Yeah, I think it depends on each person. No, I mean I chew it.
Oh, you do
I
it?
love the taste.
Oh wow! I know why.
But
Because you're healthy.
oh, really?
You know, no, this is true, guys. This is true. People who are healthy, when they eat unhealthy food, it tastes bad. People who are unhealthy, when they eat healthy food, it tastes terrible. Okay, so I noticed when I was unhealthy, when I only ate meat, I hated vegetables. It tasted terrible. But as I got fitter, slimmer, my taste buds came back to its natural form, and it started to tell me, "Ooh, carrots are good for you. Ooh, pek chai is good for you. Ooh, that fried chicken. Well, the oil. Yeah." But when you have a terrible health, all your warning systems shut down. In fact, and then it just lets you eat more and more unhealthy food. What was the question again?
The question is there any difference in effect?
Yes. Okay, number one, your teeth can actually become whiter. Yes, I'm not joking. Okay, so and those of you, if you ever get into a situation where you have a toothache and you can't get to the dentist in time and it's killing you, try chewing a tablet. Just get a PPAR tablet and chew. It actually reduces the pain. I was asking quite a few dentists, why is this the case? And they were suspecting that perhaps the PPAR tablet actually helps to neutralize acid. It's an alkaline food, but I don't know whether alkalinity in food form works like that. But anyway, what it does is that it reduces the attack on the acid, and that reduces the pain when you have a toothache. Now, there's another thing for those who take extracts, especially powder. Even if you're drinking the Simply Nature PPAR liquid, we always advise our clients and patients, if they can, if you're drinking the liquid, to hold it in your mouth for like 30 seconds to a minute. And not just hold it there, but like swirl it around, fully tasting it. So Doc Johnson likes the taste. Right? Okay. For me, I just focus. I want to get well. I want to get well. Okay. So I do it regardless of the taste. The reason is because I'm sure some of us who are very into natural healing, you have heard of the term sublingual, which means you absorb under the tongue. There's a straight absorption that bypasses like your stomach, right? So that's one reason chewing something, your body can also absorb what it needs in this form. And it doesn't go through the entire process where it's broken down by the stomach and everything. So yes, when you chew tablets, it is actually better. Honestly speaking, I actually like the Plus. PPAR Plus is somewhat sweet.
Because of the resveratrol.
Because of the resveratrol, there's a natural sweetness. It's not sugar sweet, but there's there's an aroma and makes it like fragrant sweet. Okay, and in general, PPAR tablets taste like green peas. Is that what it tastes like to you, Dr. Johnson?
Tastes like seaweed.
Seaweed.
Oh, yeah.
Okay, seaweed. All right. To me, it tastes like green peas.
Green peas.
Yeah. Now that I like green peas, it's fine. Okay. One thing. I would just want to let you know, if you have furry loved ones, that means pets, right? Your dogs will love the tablets, right? And that just goes to show you how good the PPAR tablets are, because animals know what is good for them. So my dog's record, one sitting, 600 tablets. Because at home I don't eat from the bottles that you guys buy. I have the straight from factory industrial pack, right? One day my dog got to it and he ate the whole thing. Yeah, all 600 tablets. Okay, yeah, I know, very expensive.
Yeah. I'm kind of jealous.
You're jealous, right? And anyway, if you ever, I should bring next week. Someone asked me, let me flash you the picture of my dog, okay? My dog is 13 years old, but he does not look 13 years old. He grew up on PPAR tablets, okay? So anti-aging. Rowena has a question.
Oh.
I finished with honors my third session of chemo with Baclatacel and my CT scan. Okay, she said finish with honors. Yes. And she's looking forward to have PPARs, even though doctors are not suggesting it. I'm still saying money. Okay, Rowena, we look forward to you having PPARs and sharing with us all the great testimonies. And yeah, third session of chemo with honors. So I think she has very little side effects. Praise God for that.
Congratulations.
Congratulations. We are all celebrating together with you.
So we're almost at the end of the webinar. This will be our last question for tonight. It's coming from Mr. Joshua. Can BPH lead to prostate cancer?
Oh, very interesting question.
What's BPH?
BPH is benign prostatic hyperplasia.
Okay.
So it's medical term for prostate enlargement that is benign. Okay.
Good question. Thank you, Joshua.
Actually, it's not BPH is not a risk factor for prostate cancer, but if you have a prostate enlargement, yes, you can also develop prostate cancer. Okay, but BPH is not a risk factor for prostate cancer. Okay, it's not a risk factor. So, what are the risk factors for prostate cancer? Number one major risk factor is age. Okay, that is more significant than the other ones and non-modifiable. I mean, you cannot reverse your age. I mean, yeah, you can, you reverse, right? So the next one would be obesity. Then diet. If you're eating an unhealthy diet, okay. So certain foods, what are certain foods that can increase your risk of getting prostate cancer? Number one is dairy.
Dairy.
Okay. Milk products. So what are the different dairy products?
Ice cream.
Yeah, ice cream.
Cheese.
Cheese.
It's very hot today, so we really eat ice cream.
Water. So other ones. So okay. So when you look at the ingredients list, of course, when you go to the supermarket, you know which ones are dairy products because it's obvious. Like your milk, your cheese.
No, it really explains. All of us eat so much dairy products. No wonder prostate cancer is one of the big common cancers. Not in our grandfather's time in Asia, because in our Lolo's time they don't drink milk.
Yeah, if you also even nowadays, I mean, if you compare Asian people living in Asia versus people living in the Western countries, Europe, prostate cancer, it is much more prevalent in the Western areas. This is also true for developed countries like Singapore. Okay?
Yeah,
South Korea,
because we start to
Japan.
eat more ice cream, cream puff,
Yeah,
milk tea with extra foam cream on top. So
that's delicious.
it's delicious. But we now know why we have higher cancer rates.
Yeah,
higher prostate cancer rates.
Also true for colorectal cancer. I mean, if you take a look at the demographics, Singapore is actually Singapore also have a lot of colorectal cancer. It actually belongs very similar profile
as
with,
Korea, South Korea.
No, similar profile than the Western countries like US, Europe, Hungary, these countries. Okay, But I guess no, I'm suspecting is that you have the medical or the healthcare industry is well developed already, such that they really catch these
higher detection rates.
higher detection rates. That's why you have higher rates. Okay, but just looking at the diet, no, these factors play a very significant role in.
But why did you say, Doc, if BPH is not is not a factor of developing prostate cancer, but why do you then say it's still something that that could lead to prostate cancer?
Yeah,
I'm a bit confused about that.
Confused, right? Because the risk factors for developing BPH, the risk factors for developing prostate cancer are similar.
Okay, I understand now.
Yeah,
I understand now.
If you look at the tree, right, the risk factors are the trunk. Yeah, and the BPH is one branch, prostate cancer is another branch. Yeah.
Okay. Here's my analogy. Okay, if you stand under the rain, there's a chance you get wet. Okay, because the same reasons that you develop BPH, those same things can cause you to develop prostate cancer, right? So if you when it's just drizzling, I don't know whether you guys have done that when you were a kid. I used to think you can run zigzag and then the rain misses you. All right, but you can only do that for a few seconds. Okay, sooner or later the rain is gonna hit you. So what Dr. Johnson is trying to say is, if you develop BPH, the thing that caused you to develop BPH will also cause you to develop prostate cancer. So this time you're lucky, you develop BPH. Okay, and BPH won't lead to prostate cancer. It won't become prostate cancer. But the second time, you might not be so lucky. Instead of developing BPH, you might develop prostate cancer because it is the same things that cause these two illnesses. Am I correct?
Yes. So
got it.
So not all people who have BPH will develop prostate cancer. So it's the same, no? Not all people who have prostate cancer have enlarged prostates.
Oh, okay.
Okay.
Well, I thought every prostate cancer patient will have enlarged prostate.
Actually, I have two cases already. Prostate was not enlarged, but they have prostate cancer.
So the tumor grew out on.
No, it's so small.
Oh.
The tumor is so small, but their PSA is elevated.
Oh wow!
Then when they underwent MRI, it lit up. That's
okay,
cancer.
Wow.
When the doctor biopsied, it's prostate adenocarcinoma. Gleason score of 7. So,
wow.
Yeah, that happens.
So,
but not all people who have BPH will develop prostate cancer as well. My grandfather have had BPH for like 4 decades. I mean, near 4 decades. He did not have prostate cancer because he changed his diet very well. His blood parameters is much better than my brother who is 26 years old.
Wow.
Okay, so there you have it. It's the risk factors. Okay?
So there you go. All right. So Joshua asked that following up question, is it?
Yes.
So good news, Joshua. Your BPH will not become prostate cancer, but Joshua, whatever caused you to have the BPH, you might don't try it. All right. It might become prostate cancer the next time round. So it's time to make some adjustments. Again, simple things that we can do: increase our dietary fiber in our choice of foods. Okay, if you are like me when I was 10 years ago, where I'm a carnivore, I'm not even an omnivore. Okay, omnivore eats both. I only eat meat. Sorry, there's one vegetable I eat. It's called potatoes. Okay, so that was me. So during that time, what I did, right, because we still need to do something, right? And I honestly was just so stubborn and hard-headed. I just wanted the things I like. So what I did was I took tools. I took supplements. I took like dietary fiber supplements like our Cleansing Plus, right? To at least while I'm sinning, I'm also atoning, diba? You know, you go to church, but on Monday you go and not good behavior, all right? So, but at least every Sunday you try to do something. Okay, so that was that's the start. But again, that's not where you want to stop. All right, guys, everyone. I'm not saying that. I'm saying that get started today, so that things don't get worse. Right? You can get, if you can't change your lifestyle immediately, then take something to at least get what your body needs. Right? Take some dietary fiber supplements. Then take PEPA tablets or whatever protocols that Dr. Johnson will prescribe to you. Then on top of that, take baby steps and start moving towards healthy choices, because that at the end of the day is the real solution that will last you your whole life, right? Learn to enjoy the healthy choices and learn to enjoy the best of both worlds. You know, one day that terrible tasting vegetable will actually taste good. I promise you. Not today, not tomorrow, but one day that pek chai will actually taste good. All right. Now I actually enjoy pek chai a lot. My favorite now, when I go to Din Tai Fung, is not the xiao long pao. I love the string beans and the eggplant more than the xiao long pao. That's crazy, right? So that's a journey. You will get there. In the meantime, immediately tonight, today, start already doing something for your health. All right. Get the things that your body needs. Okay. That's why I said embrace supplementation. It's not for you to be dependent on, but it's something you can do right away to help you to help your body start moving in the right direction. And after that, make that lifestyle change.
Thank you, Sir Shyan. Thank you, Doc. If you guys have any follow-up questions, don't worry. We will answer each of your questions next webinar or via direct message. We hope to see you all in our future webinars to come, because next week is our turn, ladies. We will be having back-to-back webinar for Simply Nature, same day, same time, every Thursday night at 7:30 p.m. entitled Beating Cervical Cancer Treatment Strategy Guide. So what can we expect from that?
So I'm sure there'll be lots of questions about breast cancer as well.
Yeah. Speaking of breast cancer, I have this special episode coming up next Tuesday. Okay. Next Tuesday, I'm gonna be talking about one patient of mine. It's a very unique case of breast cancer, no? So for everybody.
Oh, I know who this is. Oh wow.
Yeah.
Okay.
If for everybody who has a breast cancer, if you know somebody who has breast cancer, please ask them to watch. This is Tuesday, May 2.
Oh, this is really good, everyone.
Okay.
All right, this is really good. Please spread the word, our regular viewers, right? Please spread the word. This is very good. Is this my friend?
Yes, it's your friend.
Oh wow.
Stage 4 breast cancer.
Honestly, when I introduced her to Doc Johnson, I was just being positive. You know, when you meet a personal friend who has cancer, you just want to tell her, yes, there is hope. Yeah. But actually, in my heart, I was like, oh my goodness, it's so difficult. Yeah. But the good news is she is well. She is well. Very, very inspiring and very interesting, because Dr. Johnson told me, you know how many types of cancer she has in her breast tumor? It's not one, it's multiple types of cancer. And yet she beat it all. All right. So you got to tune in. You got to tune in on next Tuesday.
Yeah, next Tuesday.
I will be in Singapore. I will be listening from Singapore.
Yep.
All right.
Okay. So it's a case presentation. Okay. So this is a real life story. Okay.
Okay, that's great.
So yeah, and Thursday, yeah, please watch. Well, so that would be cervical cancer.
So to everyone, please spread the word. You know, I think they'll be very inspiring. And breast cancer is one of the most common cancers for ladies, and it's also one of the hottest topics. Every time we do anything on breast cancer, there are a lot of viewers and lots of questions.
Yeah, so that's just right in time for the upcoming Mother's Day.
That's true. All right.
So before we say goodbye, kindly give our viewers your parting words for tonight, starting off with Sir Shyan.
Okay, I think I've said a lot tonight. I'm going to steal Doc Johnson's line. I hope you learned a lot tonight. Okay, it's really nice to be back here with Doc Johnson again. It's so nice to really go back into this format. I think we really enjoy this format where we answer your questions. And I hope that next week you will ask even more questions and it will spark a very lively conversation. And not only will you learn something, both Doc Johnson and I will learn something as well. So thank you. We are back. That's my parting words. We're back. All right. Join us every Thursday. But next Tuesday, there's a special one. Don't forget, don't miss it. There's a special presentation on a rare breast cancer case.
Yeah. Just happy to be here again, no, to see all of you again. Now we're back, no, we're back together. Okay. So yeah, just want to thank you again for all of you who stayed with us until this time at night, no. I know a lot of you are very busy, but it's really good that all of you are taking proactive action to learn. I mean, kudos to all of you. So that's it for me. Yeah, see you next week.
Yeah, so before the webinars, there's another long weekend ahead. And with the rising number of COVID cases, make sure you guard your family's health with the help of Simply Nature PPAR.
Okay, I gotta inject. I totally
Okay.
I forgot about this. I'm sorry, everybody. You know, in my world, there's no COVID. Okay, this is because number one, I just want to let everybody know there is a rise in COVID. I think we are no longer panicking like 2 years ago. I don't think we're going to go into a lockdown, but it doesn't mean that COVID is not real. All right. Now, I just said that COVID doesn't exist in my world because, in the sense that I was never afraid of COVID because we had a solution for it. All right. So I won't go too much into detail, but basically, even the Simply Nature PPAR tablets is a great place to start for preventive. It actually prevents the buildup of mucus in your lungs. It's great for your cardio. It's great for anti-inflammation, and that's what the COVID damage really is. It creates a lot of inflammation. Yeah. So take your tablets. During the lockdown period, that 2 years, we had so many frontliners who then shared with us because they were on tablets, even when they were struck with COVID, they got back up really quickly. And after the first bout of COVID, when you get your first bout of COVID, you develop a kind of an immunity to it. And together with the PPAR tablets, basically, it just made them able to go to a front line and they never got infected again. Or even if they did get infected, this particular nurse, no symptoms the second time around, asymptomatic, right? So the COVID cases are on the rise, not only in the Philippines, but also in Singapore. I heard that this time when I go back to Singapore, I might have to wear a mask. Yeah, so I packed 3 masks in my bag just in case the regulations come in. So again, there's something you can do to protect yourself. Now we're not afraid of catching COVID. In a way, you can't avoid catching COVID. If it gets you, it gets you. But at least now we know there are many things that you can do, and PPAR tablets is one of them. And of course, the moment you do get COVID, have a consult with Dr. Johnson. Plenty of advice on how to help you recover quickly and strong.
Okay, last one question from Mr. Mario
There's a question
from Facebook. Okay, how do we take PPAR's powder if we're going to start chemo with trastuzumab?
Okay, depends on how well your body is. If you are healthy enough, then my advice would be 2 scoops twice a day. But if you are someone with a lot of side effects, quite weak, then my advice would be 3 scoops 3 times a day. That's how I gauge it.
So if you're weak, take more. All right, it will strengthen you.
Yeah.
Thank you. I hope that answers your questions, Sir Mario. That's all we've got time for today.
Mario, if any additional questions, go for a consult with Dr. Johnson.
Thank you once again for watching Simply Nature webinar, because your curiosity about your health condition and your victory over cancer and metabolic diseases is what keeps us going. Because here in Simply Nature, we are always with you from start to healing. Thank you, everyone. Good night, and God bless you all.
Good night.